of clinical experience in sickle cell disease, and she's a member of National Adult Sickle Cell Provider Network and leads the Transition Medical Home Committee for the SERGG, our collaborative. Her clinical interests include improving health literacy and chronic pain management, but her passion for transitioning is very evident. We feel so lucky to have a champion in our region who has taken this on and is really leading at a regional level our work group for transitioning. It's a great pleasure. Welcome, Doctor.
Thank you very much. And I'm not going to talk a lot today because I have an amazing graduate student who has done phenomenal work by surveying the southeastern region with regards to the status of transition services, because as some of you have heard, if you don't know where we start from, you can't decide where we're going to go, and you can't measure if what you're doing is actually working or not. And so I'm going to quickly introduce Sangeetha. She's going to talk about our needs assessment in the southeastern region on transition services. And it just shows some very interesting data. Part of the issue is, do we know who we're surveying? Are we surveying the right population? Are we reaching the right people? And are the right people sending in their responses, or are they too afraid to respond because they may not have a lot going on with regards to transition? So without a lot of fuss, I'm going to bring Sangeetha up here. Okay. Technical difficulties. Okay, good. Very good.
Thank you, Dr. Rifi. Good afternoon, everybody. Today we're going to take a look at some of the results from our regional transitioning workgroup needs assessment. This is a general overview or flow of our presentation today. We'll go over the purpose, the methodology we adopted. The results would be a snapshot of the results instead of going in depth. Limitations, some of the limitations that we had, and the next steps proposed by the workgroup. The purpose of our needs assessment was to get a basic understanding and also assess the existing protocols of sickle cell disease and PKU healthcare transition programs within the SERGG region. As we've spoken before, these are the 10 states within the region. The methodology that we adopted was an online survey. We felt that this was the best way to get access to the participants within the region. The inclusion criteria was pretty broad. We wanted to include all individuals who work closely with transitioning youth and caregivers. So therefore, we included community organizations, hospitals, clinics. We also included not-for-profit organizations and academic institutions. The instrument was developed and adapted based on the 6 core elements of GOT transition. We had about 71 items, and we also had the opportunity to pilot test this instrument at a conference in Miami where we had both the adult care providers and pediatric providers. The recruitment of participants was primarily through convenience sampling. We started off with our SERGG directory, and so also with the members in the work group, and snowball sampling thereof. And the length of time to complete each survey was approximately 20 minutes. As you can see, that was one of our sample items on the instrument. All right, so let's get started and see what some of our demographics were like. If you see, for sickle cell disease, we had about 21 participants. Most of the participants were from North Carolina, and at least one of them responded from the others who did. From the members who responded for sickle cell disease, at least 60% said that they did have a formal transition program. For PKU, this was not so much the case. We had about 10 participants from across the region, and only 10% of that 10 participants said that they had a formal transition program. This is the general distribution of the participant profile. You can see most of the participants are from academic institutions or universities. For sickle cell disease, 52% of the respondents were from pediatric subspecialty and 14% from adult subspecialty. there were no respondents from primary care providers, either pediatrics or adult care. For PKU, we had most of them as dietitians as respondents, and 20% from pediatric and adult subspecialty. So let's move on to see what our results are. These are based off the 6 core elements, so we will go one by one with those core elements, starting off with healthcare transition policy. When we talk about transition policy, we're talking about whether institutions or practices have a transition policy at all. If they do, how do they go about developing this? How do they go about sharing this with either their patients and staff? So the responses that we got were primarily for sickle cell disease, only 48% said that they had a policy for healthcare transition. On the other hand, for PKU, none of the participants said that they had a healthcare transition policy. When we speak about tracking and monitoring, we're trying to see how do practices and institutions identify or have a criteria for identifying transitioning youth, and how do they track them thereof. For sickle cell, we saw that 62% had a criteria for identifying transitioning youth. Within that, most of them either used electronic health records, progress notes to track transition. For PKU, we see that only 10% had a criteria for identifying transitioning youth, and within that, most of them either used staff memory, electronic health records, or progress notes. Transition readiness. As the picture illustrates, transition readiness is very unique to individuals and families within the transition process. So when we talk about what institutions and practices do, we're seeing when do they start assessing readiness, and how often do they assess readiness, and what are some of the tools that they use to assess readiness. For sickle cell, approximately 48% said that they did have a protocol to assess transitioning readiness, and within that 48%, most of them used their own developed scale or an adopted scale from another institution. Some of them still use checklists. As for PKU, none of the participants had a protocol for assessing transition readiness. Transition planning is yet another important element of transition. We're talking about preparing individuals for transition. When we see sickle cell disease, most of the participants said that they prepare individuals with self-advocacy skills or for preparing them for the adult care approach, whereas for PKU, most of them said that they prepared them with access to information or in matters of privacy. Transfer of care. We see that for sickle cell, they said 53% participants said that they had a protocol for transfer, and within that, they at least confirmed the first appointment with the adult care provider. If not, they transferred at a time when the patient was stable. They also have 52% within that 53 said that they had established a referral network of adult care providers. And most of them developed relations with adult care providers either through existing adult care providers that they knew of or providers within the network. 86% said they communicate with them through telephone. Transfer of care for PKU, as we see, there were no participants who said that they had a protocol for transfer of care. Transfer completion and follow-up, this is the final element of core transition and the 6 core elements. And we see that at least for sickle cell disease, 38% said that they did have a formal process of contacting young adults 3 to 6 months after the last pediatric visit. For PKU, this wasn't so much the case. So we've gone by our results right now, but we would like to acknowledge some of the limitations of this needs assessment. Firstly, we felt that there is a possibility that the length of the survey instrument could be a huge limitation. A response bias, as Dr. Rifi was just talking, we may not have heard the actual results or protocols with these institutions. Sampling frame. We extended the survey mostly to the members in our directory and work groups. So did we miss out any of those practices or organizations that are actually doing work out there and could have been captured? So that way, our generalizability has been limited. Future directions. One of the first things that we would like to do is get in touch with our patient population, understand their experiences pre-transition and post-transition, understand what their expectations have been, and see if programs actually, if transition programs are able to match those expectations. We also want to look at the 3 models within our region. It may be any state, any working model. Of course, no no two programs can be the same, but we're trying to see what are the different models that can be developed, understand them in detail, and then go about building that program based on the 6 core elements, evaluate them over a period of time to see if there are actual improvements in the outcomes. We also want to develop and foster relationships between pediatric and adult care providers. We're trying ways and means to do this, and a common platform is something that we're looking at. And also we want to talk to the PKU providers in specific, want to know where the gaps lie, specifically with transition. We can see with our results we couldn't get much. Hopefully reach out to them in person and see the needs for transition services. Finally, we would like to thank SERGG and the Medical Transitioning Work Group. Thank you, everybody.